to today's Public Health Essentials for Public Health Department's 2024 webinar series. Today's webinar is being hosted by the Pennsylvania Public Health Association and Public Health Management Corporation through support from the Centers for Disease Control and Prevention, Public Health Infrastructure Grant, and the National Association of City and County Health Officials. The Pennsylvania Public Health Association is the state association of the American Public Health Association and seeks to advance health in all policies throughout the Commonwealth of Pennsylvania. Public Health Management Corporation represents the Public Health Institute of both Pennsylvania and Delaware that supports healthier communities through partnerships with government, foundations, businesses, community-based organizations, and it fulfills its mission to improve the health of the community by providing outreach, health promotion, education, research, planning, technical assistance, and direct services. I'm Christine Ganella, and I'm the Executive Director of the Pennsylvania Public Health Association and the Managing Director of Strategy Development with Public Health Management Corporation. On the next slide, I will share a bit more about the Pennsylvania Public Health Association and our role in sharing about this year's release of the County Health Rankings data. The Pennsylvania Public Health Association was selected as the team to present the 2024 Pennsylvania Public Health Rankings. As a membership organization for public health practitioners and professionals from across the Commonwealth, the Pennsylvania Public Health Association convenes partners, informs current and emerging public health professionals on our identified priority areas, and amplifies public health policy in Pennsylvania. The County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute and explores differences in health within and across communities. The program highlights policies and practices that facilitate and/or inhibit community health. County Health Rankings and Roadmaps aims to grow a shared understanding of health, equity, and the power of communities to improve health for all. This work is rooted in a long-term vision where all people and places have what they need to thrive. Next, I will walk us through today's agenda. Today, we will review the County Health Rankings and Roadmaps background and methodology. We'll provide an overview of the 2024 Pennsylvania results. We'll provide an introduction to transformative narrative concepts and practices, and we'll identify the County Health Rankings and Roadmap resources. Moving on to our first agenda, what are County Health Rankings and Roadmaps? What is the County Health Ranking and Roadmaps? It's a program of the University of Wisconsin Population Health Institute and supported by the Robert Wood Johnson Foundation, who has worked to improve health and healthcare for more than 45 years. This data and evidence is released annually to build awareness around multiple factors influencing health across communities. County Health Rankings then creates a specifically curated snapshot of nearly every county in all 50 states. Along with the rankings are guidance, tools, and resources designed to accelerate community learning and action. The work of the program is rooted in health equity, and the mission is to give every community a fair and just opportunity to be as healthy as possible. It is important to note that this year, the County Health Rankings and Roadmaps have done away with the numerical rankings and now use health outcome and health factor summaries to replace the rankings provided in previous years. This shows how the counties fare relative to other counties in the state and nation and supports solidarity and action to improve health. On the next slide, we will discuss the methodology and County Health Rankings model. The County Health Rankings Health Snapshot is compiled using 30 county-level metrics from national and state data sources. The County Health Rankings and Roadmap model illustrates the many factors that, if improved, can help make counties or communities healthier places to live, learn, work, and play. Health outcomes includes two sub-areas, here highlighted in green, which represent length of life and quality of life. Health factors include 4 sub-areas highlighted here in blue, which represent health behaviors, clinical care, social and economic factors, and physical environment. Each of these health outcomes and health factor sub-areas are composed of individual measures. Policies and programs highlighted here in dark green or dark orange at the local, state, and federal levels play an important role in influencing these health outcomes and health factors. By implementing strategies that target the specific health challenges of a community, there is an opportunity to influence how long and how well people live. On the next slide, I will give some further examples of these three components. There is a wide range of policies, programs, systems, and environmental changes that can make a difference locally. Some interventions target individual behavior, such as influencing dietary choices, exercise levels, or alcohol consumption. Other strategies try to tackle systems and structures, such as enhancing opportunities for education, stimulating economic development, and increasing neighborhood safety. No single strategy will ensure that everyone in the community can be healthier. Many policies and practices in the past have marginalized groups of residents, such as people of color, making it difficult to access resources and supports necessary to thrive. Our collective health and well-being depend on building opportunity for everyone. A specific theme for the 2024 County Health Rankings and Roadmaps is civic infrastructure and civic participation. We can go to the next slide. This looks at how community members can be engaged in their community and participate in elections. Policies, programs, governance are both inputs and outputs of civic infrastructure. This year, County Health Rankings and Roadmaps reported on the percentage of voter participation in the 2020 election in each county, which we will explore later. Let us look at two elements of civic health: civic infrastructure and civic participation. Civic infrastructure provides us with spaces to meet, make our voices heard, engage in cultural activities, and assure belonging. How we cultivate these spaces is also part of infrastructure. This requires intentional policies and practices to create and cultivate environments where everyone can exchange ideas and solve problems together. Civic participation includes the ways people engage in community life to improve conditions, whether through voting, advocacy, volunteering, mentoring, or participating in unions so that their work can meet their basic needs. Supporting ways to participate is foundational to building healthy, thriving, and equitable communities. This year, the City County Health Rankings continues to focus on the connections between civic participation and health, called civic health. Evidence showing that participating in our communities, whether through volunteering or joining neighborhood groups, strengthens our social connections and sense of belonging, which in turn benefits our physical and mental health. Civic participation from the political or electoral processes through voting or organizing can also influence policies that create opportunities for health, including safe spaces to live, work, and funding for public health initiatives. On the next slide, we will take a closer look at examples of civic infrastructure. Civic infrastructure are spaces, governance, and resources and shared networks where we connect and are informed. For example, opportunities to access local news, broadband internet, and public libraries. Civic spaces are where we learn, stay informed, get connected, and come to understand how decisions are made so that we can advocate for our community's needs. Schools, libraries, and community centers are civic spaces that offer civic education, leadership programs, service learning, and access to information. Information comes through local newspapers and other virtual and physical news outlets. All of these help us understand how decisions are made and what is happening locally. Governance and resources are how we govern determines who has a say, what is prioritized, and how resources are allocated. Components of governance include voter registration laws, redistricting commissions, open meetings, community advisory boards, and their processes such as participatory budgeting and investment procedures from community and economic development organizations. Policies, laws, ordinance, and practices determine how easy it is to participate in civic life and for whom, as well as how resources are invested in civic infrastructure to support participation. Social networks and shared culture where we can use our power in many ways to achieve common goals. Volunteering, joining a social group, and helping neighborhoods connect us fosters belonging and supports a shared purpose. Civic infrastructure is a representation of a healthy community beyond the health outcomes level. The graphic on the next slide demonstrates what a strong civic infrastructure can look like. Civic infrastructure and the opportunity to live long and well varies across the U.S. counties. Civic infrastructure varies across U.S. counties and regions. Counties in the Northeast, Midwest, and West have more available and resourced civic infrastructure, including access to civic spaces and information such as broadband, libraries, newspapers, social associations, parks, and schools. These counties often have more social and economic opportunity. Where types of longstanding discrimination and disinvestment have occurred through policies and practices, such as racial segregation through redlining, legal actions to terminate tribal culture, and land rights and disinvestment in rural communities, counties have fewer social and economic opportunities. This includes opportunities for education, employment, income, and family and social support. These counties fall among the least healthy in measures of length and quality of life. Now, let's walk through the county health rankings and roadmap model this year, which emphasizes civic health, doing away with rankings. And let's take a closer look at Pennsylvania county health data. The left map in blue shows 2024 county health rank factors in counties across Pennsylvania. Health factors in blue include health behaviors, including adult smoking rates, adult obesity rates, access to exercise opportunities, and sexually transmitted infections. Clinical care account for uninsured persons, ratio of primary care physicians, mental health providers, dentists, flu vaccine rates, and mammography screenings. The social factors and economic factors include completion of high school, completion of college, children in poverty, income inequality, social associations, and injury death. And the physical environment accounts for air pollution, drinking water violations, severe housing problems, and driving alone to work and long commuting times. The right map in green shows county health outcomes. So remember, health factors on the left in blue, health outcomes to the right in green. Health outcomes represent length and quality of life. And just to name a few of these, life expectancy, premature death, child mortality, infant mortality, frequent physical distress, mental distress, HIV prevalence, diabetes prevalence, poor or fair health, poor physical health days, poor mental health days, and low birth weight. Notice how factors in purple to blue don't always translate to the correlating shade of green on the health outcomes graph. Using the County Health Rankings and Roadmaps 2024 theme of civic engagement, this map measures the percentage of citizens age 18 or older who voted in the 2020 U.S. presidential election. Counties with states and regions with more structural barriers to civic participation show signs of lower rates of voter turnout, for example. Structural barriers are policies and practices that create or maintain unfair and unjust outcomes. Examples of structural barriers to civic health include gerrymandering districts, laws and practices that create obstacles to voting, and disinvested civic infrastructure. The states outlined in white are identified as having barriers to civic engagement. On the right side is a map of Pennsylvania with percentage of voter engagement. While PA is not recognized as having structural barriers to civic participation, voter participation greatly varies across counties. Let's review some more examples of how Pennsylvania compares to the national average on a variety of health factors. Let's explore the Pennsylvania health trends highlighted in the 2024 Health Findings Report. According to the data highlighting health behaviors, access to exercise opportunities, PA is higher than the U.S. average. Teen births, PA is lower than the U.S. average. And alcohol-impaired driving deaths shows PA is comparable to the U.S. average. Regarding clinical care, overall, Pennsylvania has consistently greater access to clinical care with a lower uninsured population, slightly more dentists and primary care physicians than the national averages, and greater uptake in flu vaccinations in 2021. Flu vaccines demonstrate that PA is consistently higher than the U.S. average. Regarding social and economic factors, High school completion among adults 25 and older, the data shows that PA is higher than average, but lots of county variation. In Pennsylvania, there are 96 deaths due to injuries such as homicides, suicides, motor vehicle crashes, and poisoning per 100,000 people. This remains higher than the U.S. average of 80 deaths per 100,000 people. In Pennsylvania, this ranged from 40 to 142 injury deaths per 100,000 people across counties in the state. Overall, Pennsylvania closely follows U.S. trends in many health factors and trends slightly better in health outcomes, except in injury-related deaths. Vaccines across counties. PA has a population of roughly 13 million people across 67 counties and 2,560 municipalities. It is an important account for the varying health outcomes across each county presented in this data and what narratives can form from just examining health behaviors, factors, and outcomes at the county and state level. Does this feel representative of Pennsylvania? What narratives form when looking at this map? How can we talk about this data with public health professionals, community members, and policymakers? This brings us to our third agenda item, transforming narratives. The purpose of the the purpose of the county health rankings and roadmaps is to help counties understand that there are many factors that influence health. County health rankings and roadmaps offers data, strategies, and tools to illustrate what impacts health and highlights the power to make change through policies, practices, and resource allocations, and how they can shape community conditions so that everyone thrives. Communities should use the rankings to grow community power for health equity initiatives among government agencies, healthcare providers, community organizations, business leaders, policymakers, and the public. County health rankings and roadmaps has done away with the rankings in order to shift away from the individualistic nature of the narrative of health. Instead, comparing counties should be used as a tool to take action to improve in health behaviors, health factors, and social economic factors in solidarity with one another, and progressing towards better health. Let's examine what narratives are and how they can impact health equity. Using the County Health Rankings and Roadmaps Findings Report, we create narratives or value-based stories to understand our communities. The narratives we create can shift public consciousness and change what is possible. Narratives are a way of communicating and or reinforcing ideas and engaging people in considering their own understanding of the world around them. Narratives provide an understanding interpretation of people and situations and are grounded in and reflective of a larger set of values and beliefs. Worldviews and the narratives that reinforce them can stand in the way of advancing health and health equity. We must shift mindsets to create a world in which everyone thrives. Shifting from dominant to transformative narratives can change people's understanding of what is possible to advance structural change for health and equity, including racial justice. Dominant narratives can be replaced to reflect the possibility of a world in which everyone has opportunities to thrive. Public health and healthcare must move forward towards transformative narratives. Together, the public health and healthcare fields can advance narratives that reflect a set of values to shape a more equitable vision. To do so requires an understanding of the way power works and how to build and wield it. We can shift narratives by exposing dominant narratives. Dominant narratives are embedded in institutions, structures, and norms. People create, advance, and maintain them to shape possibilities, decisions, policies, and culture. These dominant narratives are drawn from the values and beliefs held by those in power and used to accept or reject information and ideas that influence decisions. Uncovering and elevating transformative narratives can promote narratives that shape a different vision of the future. Contrasting dominant and transformative narratives and offering a choice between them, shifting narratives is not about winning an argument, it is about engaging people to explore their values, beliefs, and assumptions to identify how they shape what happens in the world. And now I will leave you with a quote by writer and activist James Baldwin. The world changes according to the way people see it. And if you alter, even by a millimeter, the way a person looks at reality, then you can change it. Thank you for taking the time today to step through the County Health Rankings and Roadmaps presentation. If you're not a member of the Pennsylvania Public Health Association, please consider joining as a member. You can scan the QR code on the screen or visit us at our website or on Instagram or X. Have a wonderful day.